Measles cases are continuing to climb in the U.S. The CDC reports 171 new cases so far this year across 9 states. In South Carolina, measles is spreading rapidly. Health officials confirmed 124 new cases since last Friday, bringing the statewide total to 434. This comes after the worst year for measles in the U.S. since 1991. As cases rise, a new study finds that opting out of childhood vaccines is becoming more commonplace in parts of the U.S. The research published Wednesday in the medical journal JAMA found that non-medical exemption rates for vaccines, typically required in schools, have increased more than half of the counties in the U.S. since the COVID-19 pandemic. CBS News medical contributor Dr. Céline Gounder joins us now. She's also an editor-at-large for public health at KFF News. So we're seeing these measles cases rise in some parts of the U.S. How serious is this moment?
Lindsay, this is very concerning because measles is one of the most contagious infectious diseases known to man. So to put this in a little bit of context, if you were to compare measles to influenza, let's say I had influenza, I might infect 1 or 2 other people. If I had measles, I would infect on average 12 to 18 other people. So it is a far more infectious respiratory virus. And this is why we need such high rates of vaccination, over 95%, in order to prevent an outbreak from happening.
So January 20th marks 1 year since the big Texas outbreak, and the Pan American Health Organization will soon decide whether the U.S. will keep its elimination status. Remind us what that is and what is at stake.
Right. So elimination does not mean 0 cases. What it means is that you don't have continuous transmission of the virus in the country. So if we have 12 months, which is what we're coming up against, 12 months of continuous transmission of measles in the United States, we would be losing our measles elimination status. And that's not just symbolic. It means that we are at much higher risk for continued outbreaks. It means that we may have to consider a different vaccination schedule, something like what they do in developing countries, where they have an additional dose of measles vaccine at the age of 6 months. And it means travelers from outside the country to the U.S. would also have to do what they might do for travel to a developing country, have to get a booster dose of measles vaccine.
Federal officials argue that the outbreaks aren't connected, so that elimination status should stay intact. Does that argument hold?
Well, technically, if these outbreaks are not connected, they may have an argument. However, from a public health perspective, these outbreaks are connected, and here's why. It's because we are seeing these low vaccination rates, dropping vaccination rates across the country, well below that 95% threshold to prevent outbreaks. So in that sense, they're all connected.
Okay, so for parents who are wondering what to do now, especially with travel, with school, what's your advice?
Well, look, make sure your child is up to date with their measles vaccinations. If you are in an area where there is an active outbreak, talk to your pediatrician about getting an extra dose at 6 months if your child is that young, an extra dose of measles vaccine at 6 months, and then still get the normal vaccine doses at 12 to 15 months and at 4 to 6 years. If your child has symptoms of measles, so fever, watery eyes, runny nose, cough, and of course the measles rash, call ahead to your pediatrician's office so that they know you might be coming in and they can take precautions before you come and infect others with measles.
Okay, Dr. Céline Gounder, thank you.